We're back now with Dr. Murali Ramaswamy from Cone Health, and we're talking all things respiratory illnesses and what you need to do if this hits you at home. All right, so we've talked about fever and we've talked about coughs. Let's now talk about congestion. What steps do we need to take from home to help with stuffy nose and congestion?
Okay, that's a great question. Again, it's about symptom relief, and it's about taking, nasal sprays such as saline nasal spray, and if that doesn't work, Afrin, which is the chemical name is oxymetazoline, that can help, although it's only to be used for a few days. These things can help reduce the congestion. Sometimes antihistamine tablets such as Benadryl or a non-sleepy version of Benadryl like Allegro, those things can again help. Again, the idea of relieving sinus congestion is about feeling better. It really doesn't address the cause, which is usually a virus. And so that then is a separate way you address the cause of the sinus congestion. But it's really important to feel better because, you don't want to feel miserable with sinus congestion.
Yeah, while the virus is taking its time to work its way out of our body, we definitely want to feel better. All right. When do we need to seek help and from whom with the whole congestion thing?
Yeah, this is a great thing. When I was growing up, people would say, with treatment, it takes a week. Without treatment, it takes 7 days. But the knowledge on respiratory viruses has changed a lot. We know that viruses such as flu, COVID, RSV can be dangerous, can be lethal, especially to people who are at risk, such as people with lung disease, heart disease, kidney disease, cancer. So it's really important to recognize, even when those symptoms are mild, to seek medical attention, even with a phone call the following day to your doctor's office. There are antivirals such as Tamiflu for flu, Paxlovid for COVID, that can help. So it's important to start those antivirals early in order to prevent the virus from becoming dangerous and putting you in the hospital.
All right, with so many respiratory illnesses going around right now, is COVID-19 testing still recommended?
Yes, absolutely. There are actually 18 different viruses, including the strains, and these are the respiratory viruses. It's really hard to separate one from the other just based on fever or cold or congestion or cough. It is really hard to say, oh, it's COVID, oh, it is flu, oh, it is RSV. It's really hard. Testing is the best method. And it's really important to get tested for COVID because that's highly contagious. The testing is easily available. There is treatment, and that can put you in the hospital if things get worse. And there's a risk of death with that. So it's really important to get COVID tested.
All right, so this has changed over all of the years. If you test positive now, how long do you need to isolate for?
Yes, the isolation is 10 to 11 days. The isolation is 5 days, but then you can come out after 5 days of isolation and then mask for another 5 days. The contagious period is 10 to 11 days.
All right, but what happens if you test negative, but you still feel awful? So what should you do with that?
Okay, so for that, if you're testing negative for the first time and it's an antigen test, it could still be COVID. The recommendation is to test at least a couple of more times to be confident that it is not COVID. And if it's not COVID, it could be another virus such as flu or RSV. And there is treatment for flu. So one should seek medical attention in order to diagnose flu. Flu testing is not easily available over the counter, so you'll have to call your doctor for that.
All right, we have about 1 minute. What are the things that we can do to help stop the spread of any kind of stuffy nose, cough, fever thing in the house and with work?
Yeah, this is a great question. I think at house isolating, by that I mean staying away from your loved ones, wearing a mask, and waiting for that period where you can be contagious to subside. So that really reduces transmission inside the household. And then when you go out to work 5 days later, masking for another 5 days really reduces the spread of the virus. That is in the context of having an actual viral infection.
Okay.
But in the long run, the best prevention is to take vaccine. Vaccine definitely, it does not prevent you from getting sick, although it reduces the viral load, and it definitely prevents one from ending up in the hospital and dying from these viruses.
Okay, we understand. All right, thank you for your time and your expertise. We appreciate that. If you missed any of this, this is going to be in the To Your Wellbeing section on our website.